Hi, it's been a while since I did a video where I was talking about after effects of having cataract surgery. I had the first surgery in November, had the second one for the other eye in December, and it hasn't really gone overly smooth. And I talked about some of the things that were going on in that video, and then one that was after it, just really briefly. And I wanted to just mention a few things because I've learned a lot. One of those things that a lot of us don't do before surgery is we don't really do a deep dive into what could happen. We don't ever ask our doctors enough questions. We don't sometimes know the questions we should ask, but at the very least, we should probably at least look it up. I had actually looked it up online. And so I knew a couple of things, but I didn't know about the recovery period. That's a key thing in finding out just how long you might have issues. So I had another appointment today. And the reason I had this appointment today is because the last time I had the appointment, he wasn't happy with how things were going. My eyes were still more swollen than they should have been. He asked me if my glucose levels were high because I'm diabetic. And I said, I've had a little trouble in controlling it. He says, well, you're going to have to do something about that before we have the next meeting because we might have to do some other things. I didn't like the sound of other things. I had no clue what that actually meant, but I was able to get my eye drops. And when I came home, I saw that they had set up my next appointment for me, but they said injection. I'm like, wait, what? Because he hadn't mentioned anything about an injection. And I'm pretty much like most people. I'm scared of needles. I don't like shots. I don't like IVs. I don't like when they have to take blood. I don't like any of that. Yes, I do have to do an injection for my insulin, but it's this little tiny needle. I don't even feel that. So that doesn't really count. Anyway, I made it my goal to get total control of my glucose levels. You may have heard it under another name, but I still call it glucose. I'm old guy. Leave me alone. Anyway, I got control over it after 2 days, and I haven't had a bad reading since then. So I've done pretty well. I've done good enough so that I can actually read things on my monitor. I had mentioned that was a problem I had before, but I can read things on my monitor now without having to wear these readers. I don't need those anymore. So I'm thinking, yeah, you know what? This looks pretty good. I'm kind of happy with myself. I hope he'll be happy with it. So I go in there today and, you get the nurse first. And the nurse does, the eye testing first. And so she puts up the thing so I can read the eye chart. The right eye did really well. The left eye, I said, oh no, this is going to be bad. Now, I will tell you the truth. I had actually memorized what the first line was, and I had memorized most of the second line, but I hadn't really thought much about memorizing the other lines. Right eye didn't bother me. The left eye, it was bothering me. And now I have memorized all five of them, but I'm not going to cheat the next time I go because, I want this to be better. Anyway, she numbs my eyes and she does some kind of test in there. And then she leaves. And then this other lady comes in and takes me to get a picture, so to speak, because it's a camera, but it kind of sees inside the eye. So you get that thing. And then I go back and I wait for a while because they were really busy. And I found out later on that on Thursdays, they hold kind of a clinic kind of thing, and the room was packed. So it's the longest I've ever had to wait to see the doctor. It was the longest I'd ever have to wait just to get into a room. And I started to almost fall asleep. I was really drowsy. I'm going to come back to that in a little while. Anyway, he finally comes in and he asks me, okay, what do you think? I said, well, I can now read my, you know, what's on my computer screen. I can read it. I don't need to wear the readers anymore. I think it's going kind of well. He says, well, that's good. Let me look at the data. So he looks at the data and then he looks at the image, and I didn't want to look because I just had this feeling that because of the left eye, he was going to say that I needed an injection, and I really didn't want an injection. So anyway, we talked about it after the fact. And he said, well, your right eye is doing really good. Your left eye, it's not really improving as much. It has improved, but it's not improving as much. And you actually have two choices since you have shown improvement. One is you can continue taking the eye drops, and two is that we can go the injection route, which might do things a little faster. But, I'm going to leave that up to you. I don't like needles. So I said, I will try the drops. I will make sure that I stay religiously in using them. You see that I've shown improvement? He says, yes, you have. Let's see how that works. We're going to give you 6 weeks this time. Keep your glucose under control, and let's see how it goes. Wonderful. So I leave there and I get home and I'm exhausted, and I don't know why I'm exhausted. And so I texted a friend of mine and I said, I don't know why I am so tired. I was tired the day I had the second surgery because it took them longer to get to me because they had an emergency patient before me. And I just had all kind of trouble staying awake. I know I dozed off a couple of times. So I decide I'm just going to take a quick nap. So I go into the bedroom and take a quick nap, and I wake up and I feel better, but I'm still a little bit off. And then it hit me that the numbing stuff that they use to put in the eyes, well, you don't think that you're really feeling anything, but it turns out you are. So it made me feel groggy. That's the same thing I had for the second surgery. I didn't have that for the first one, but the second surgery, I fell asleep. Here I fell asleep because it was over an hour before the doctor came in to see me. So I said, wow, that's interesting. So that's something else that I knew about. So I had to go to the store to get the prescription for one of the eye drops because I'd run out of that one. Turns out I got both of them. So I came home and something said, you know what, let's look this up, because I never looked up either of these two eye drops to find out what they did. So one of the eye drops basically is to help, reduce the swelling. The other one is to keep you safe from infections and all this other kind of stuff. However, one of the things that it said on both of these that the doctor has never told me and no one else has ever told me is that if you're taking more than one medication, you need to give those to yourself 5 minutes apart. Well, that would have been nice to know. No one ever said, give yourself the first eye drops and then wait 5 minutes and do the second one. And the other thing they never said was 2 eye drops in each eye. I've always only done one. Now, I don't know if that would have made things better, but the way I read things, if you're doubling the dose, you're doubling the, quickness of everything, working out in your favor. So those are the two things that I wish I had known beforehand. So that's what I'm going to do. It's going to be easy to keep my glucose under control, so I don't have to worry about that. I still have lows every once in a while, which basically means that I didn't eat enough so that I don't crash during the night, or I ate too much of the wrong stuff, which made me crash. You know what? You just wake up, you know you're crashing, and you handle that. If you're diabetic, you probably know what crashing is. If you don't, you can ask. I don't mind. Anyhow, I also decided to look up just how long is it supposed to take for cataract surgery to heal? Because based on a lot of the things I was reading, it basically said about 1 month or maybe 4 to 6 weeks. It turns out it could last up to 5 to 6 months. I guess maybe that's me. Like, it's almost 3 months. I mean, I think it's next week. By next week, someday, yeah, by next week, it will have been 3 months since I had surgery on the right eye. So I'm not beating myself up. He says that I'm healing well. It does explain, however, how come even though I can see things better, there's this haziness. And I've been wondering. I look at the pictures on Instagram. I look at pictures almost everywhere else. and everything just looks a little hazy. Well, that's because of the blurriness. Because if I'm out and about, I'm driving out and about, I go to the store, I see everything clearly. But it's not a reading thing. It's not a close thing. Instagram, you're looking at it on your phone. Here's me. I'm looking at it on my phone. I'm kind of close to it. Um, so I guess that's just how that works. So if that's happening to any of y'all, now you kind of know why. And there we are. I just wanted to give that little short update and say if you have these issues, talk to the doctor about it or research it. Research it for yourself. I I got these two different things. So it's easy enough to look it up. And you can look at 3 or 4 different pages if that's how you kind of do research. I looked at 3 and then I took the good and the bad. And there was nothing that was necessarily just good, they're telling us, but it gave me information to tell me other stuff that I needed to know. So we'll see how it goes. I'm still really glad I got it. I love the fact that I can drive and see everything well without my glasses. Um, I'm going to need to do something though, because I bought these readers so I can read the phone because, that's going to be the life. And I bought them at Dollar Tree for $1.75. And this is my third pair. So they're kind of flimsy. What are you going to do? But there we go. Anyway, if you have any questions about it, let me know. If you have any comments on how things have gone for you, I'd love to hear it. Y'all take care.